Hi friends, welcome to Infocula. Let's get started with our 5 quickie MCQ daily dose. What is the correct sequence of ECG changes in hypokalemia? ST depression, flattening of T wave, pseudo-P pulmonale. Let's get started. The first change in hypokalemia is flattening of T wave. The second change in hypokalemia is pseudo-P pulmonale, and the third change is a ST depression, which is due to overlapping or overtaking of U wave over T wave. This is later followed by fusion of U wave and T wave. So the correct sequence is 2 followed by 3 followed by 1, and the answer is B. Sunflower cataract is seen in all except traumatic cataract, complicated cataract, Wilson's disease, chalcosis. Your time is up. Sunflower cataract, you can see in the picture. This is the shape of the cataract that is visible externally, is seen in chalcosis, Wilson's disease, and also in traumatic cataract. Similarly, rosette cataract is also seen in traumatic cataract. A Christmas tree cataract is seen in dystrophia myotonica. Dust-like cataract or oil drop cataract is seen in galactosemia. Polychromatic luster, a very important exam question, is seen in complicated cataract, whereas sunflower cataract, like mentioned before, is seen in Wilson's, chalcosis, and traumatic cataract. Since the question mentions except very clearly, the answer here is complicated cataract. Third question. Which is the gold standard test for paroxysmal nocturnal hemoglobinuria? I have seen a trend that students tend to pick up the option that has a fish mentioned, and that is because there is increased frequency of questions on fish lately. But be careful. Paroxysmal nocturnal hemoglobinuria is a condition which takes place during night. During night times there is hypoxia and there is acidosis, which leads to complement activation. And during such conditions, in acidosis, the RBCs that are deficient of CD55 and CD59 do not withstand the complement well, and hence there is intravascular hemolysis. To detect this CD59 and CD5, a technique called flow cytometry is used as a diagnostic test. Hence, the answer to this question is flow cytometry. Question number 4. Following a paired branch of abdominal aorta except superior mesenteric artery, lumbar artery, middle suprarenal artery, and inferior phrenic artery. Your time is up. Let's look at the diagram. You can look at the diagram. Common iliac are present bilaterally. Gonadal arteries are present bilaterally. Renal arteries are present bilaterally. Middle suprarenal is present bilaterally, and inferior phrenic is also present bilaterally. Similarly, lumbar arteries are present bilaterally. Arteries that are not bilateral are middle sacral artery, inferior mesenteric artery, superior mesenteric artery, and celiac axis. Hence, the answer here is superior mesenteric artery. Question number 5. What is the most common cause of normocalcemic tetany? Acidosis, hypophosphatemia, alkalosis, hypermagnesemia. Your time is up. Normocalcemic tetany. Tetany in general is a neurological condition that is due to nutritional deficiency of calcium, which is hypocalcemia, and hypomagnesemia. However, if the question strictly mentions a normocalcemic tetany, the most common cause is alkalosis. And this alkalosis in turn is a result of frequent vomiting or external intake of alkaline salts, primary aldosteronism, or hyperventilation. That's about it for today. Happy reading!